Here's an exclusive preview of my book, Rebuilding Health in America, A Doctor's Prescription for Reform, by Christopher Voss, MD. If you've enjoyed this excerpt, learn more by purchasing the Kindle, paperback, hardcover, or ebook edition, available now on Amazon and all major distribution platforms. Introduction: A Vision for Health in America. America's healthcare is at a crossroads. We've seen life-saving innovations, but also heartbreaking failures due to systemic inefficiencies and inequities. It's time for a call to action to reform this system. Healthcare should be a right for everyone, but one paired with personal responsibility. We must ensure universal access to care, while each of us prioritizes prevention and contributes to a healthier, more equitable society. Through evidence-based reforms and a shared commitment, we can build a healthcare model reflecting our best values: equity, empowerment, and mutual accountability. This vision of change begins with all of us. Chapter 1: The High Cost of Administration. Administrative overhead devours about 25% of U.S. healthcare spending. Complex billing and paperwork create a bloated bureaucracy that wastes billions and steals time away from patient care. The human toll is real. Doctors are frustrated and patients face dangerous delays. These delays are not just inefficiencies. They are moral failings of a system that prioritizes paperwork over people. Solutions are within reach. Streamline billing with standardized claims, leverage technology like AI to automate routine tasks, and enforce transparency in insurance costs. Cutting red tape frees up resources for patient care. Chapter 2: Physician-Owned Hospitals and the ACA. The Affordable Care Act, ACA, effectively banned new or expanded physician-owned hospitals, aiming to prevent conflicts of interest. But this crackdown also eliminated competition and innovation that doctor-led hospitals can offer. Evidence shows physician-owned hospitals excel in care. Research finds they perform at least on par with, often better than traditional hospitals on quality and patient satisfaction metrics. By lifting restrictive bans and pairing them with strong oversight, we can let physician-led hospitals thrive. With proper safeguards against self-referral abuses, empowering doctors to run hospitals means more choice, better quality, and patient-centered innovation. Chapter 3: The Problem with Private Equity. Private equity is pouring money into healthcare, treating hospitals and clinics as profit centers. These corporate owners often slash staff, cut corners, and hike prices to maximize returns, putting profits over patients. The consequences have been dire. Care quality can decline. One study linked private equity-owned nursing homes to higher mortality rates, and physicians lose autonomy under corporate mandates. Patients end up facing surprise bills, rushed visits, and a loss of trust in their care. To protect healthcare from predatory profiteering, we need bold action. Require strict review and approval of hospital buyouts. Mandate transparency about who owns our healthcare and how it's performing. Support non-profit providers to keep them competitive, and safeguard doctors' clinical judgment from corporate pressure. It's about putting patients over profits again. Chapter 4: For-Profit Medicine's Impact. In a for-profit healthcare system, financial incentives can overshadow patient needs. For-profit hospitals often prioritize lucrative procedures and cut costs, like nursing staff, a formula that boosts margins but can compromise care quality and access. We've seen the fallout. Major chains like HCA and Tenet have faced scandals for overcharging patients and even performing unnecessary treatments. Profit-driven care tends to mean higher bills for patients, overworked staff, and entire communities losing unprofitable services like rural emergency rooms. To realign priorities, we must change the rules. Shift toward value-based care that rewards health outcomes, not volume of procedures. Require for-profit providers to reinvest in community health and be transparent about costs and quality. Regulators should enforce safe staffing levels and fair pricing. The bottom line: patient well-being must come before profit. Chapter 5: Disease Creation and Management. Our healthcare model often treats disease rather than preventing it, leading to an explosion of chronic illnesses. America faces epidemics of obesity, type 2 diabetes, and heart disease, costly conditions that are largely preventable. Unhealthy lifestyles fuel this crisis. Processed, sugar-loaded foods are cheap and ubiquitous, thanks in part to subsidies for corn syrup and similar ingredients, while healthy foods are expensive or hard to find. Long work hours and sedentary routines leave little time or energy for exercise. The deck is stacked toward illness. We must redirect our focus to prevention. From schools to workplaces, the evidence is clear. Investing in healthy eating, exercise, and stress reduction can curb chronic disease and save lives. Prioritizing prevention now will reverse these trends and ensure longer, healthier lives for Americans. Chapter 6. The Wrecked Food Supply. The American food supply is broken. Decades of farm policy made junk food cheap and healthy food pricey. Government subsidies flood the market with corn, soy, and sugar, fueling ultra-processed foods, while fruits and vegetables struggle to compete in price. To fix this, we need sweeping changes. Reform farm subsidies to favor fruits and vegetables. Support local farms and farmers markets to bring fresh food into communities. And make nutrition education a priority in schools and clinics, so people can make informed, healthy choices. Innovation can help reclaim a healthy food system. Doctors are starting food as medicine programs prescribing fresh produce. Urban entrepreneurs are using vertical farms and hydroponics to grow greens in city blocks. Imagine a future where fresh produce is as affordable and ubiquitous as fast food. That's the vision. By combining smart policy and creativity, we can make healthy eating easy and accessible for all. Chapter 7. Workforce barriers to health. Good health isn't just about hospitals and clinics. It starts where we live and work. For millions in low-wage jobs, poor working conditions create health barriers. Long hours, no paid sick leave, and low-pay force, unhealthy choices like fast food meals and skipping exercise, widening health gaps. It's time to break the link between hard jobs and poor health. Employers should provide wellness programs, healthy meals, exercise time, health screenings, and pay a living wage. Basic benefits like paid sick leave, reasonable hours, and child care support would let workers eat better, rest when ill, and manage stress. Communities can help too. Partnerships with food banks can bring fresh produce to families. Free fitness classes can get people moving, and local mental health support can aid those under stress. A healthier workforce isn't just right, it boosts productivity, morale, and economic vitality for everyone. Chapter 8. EHRs and Independent Practices. Electronic health records, EHRs, were supposed to make healthcare better, but for many independent doctors, they've become a burden. Small practices struggle with pricey, complicated EHR systems that demand endless data entry, time that doctors would rather spend with patients. The result? Many independent clinics have closed or been absorbed by large health systems, partly because of these tech headaches and costs. Doctors now often spend nearly as much time clicking checkboxes and fighting software as they do treating people. And when different systems can't share data, patients suffer from repeated tests and missed information. It's time to make EHRs work for doctors, not against them. Enforce true interoperability so all systems share information seamlessly and help small practices afford modern, easy-to-use software. Insist that EHRs be designed with physicians in mind. Simple interfaces, voice dictation, and automation to cut paperwork. Done right, tech can empower doctors to focus on patients again. Chapter 9. Physician Autonomy and Modern Employment. The era of the independent doctor is fading, and with it, some of physicians' autonomy. Today, many doctors are employees of big health systems or corporate clinics, expected to follow company protocols and meet business targets that can conflict with what's best for patients. This loss of autonomy takes a toll on care. Doctors feeling like cogs in a machine report more burnout and moral distress, and patients sense it too. When appointments are rushed and care is dictated by checklists or insurance rules, the personal touch suffers and trust erodes. Let doctors be doctors again. Pass laws so corporate administrators can't override medical judgment. Support physicians who choose independent practice, and expand models like direct primary care that give doctors more time with patients. With autonomy restored, the patient-doctor bond can thrive. Chapter 10. The Dark Side of Peer Review. Peer review is meant to uphold medical standards, but it has a dark side when misused. Sham peer review happens when hospital leaders twist this process to silence or punish doctors they dislike. often those who speak up about patient safety or question hospital policies. The effects are chilling. Excellent physicians can be labeled disruptive and have their privileges revoked, not for poor care, but for challenging the powers that be. Careers are ruined and patients lose dedicated healers. Seeing this injustice, other doctors stay silent rather than speak up about problems, and everyone's care suffers. Peer review needs reform and oversight. Physicians facing review deserve fair process. Neutral outside experts on panels, a chance to defend themselves, and a right to appeal. Revise laws like HCQIA so immunity only applies when reviews are in good faith. With transparency and whistleblower protections, peer review can return to its true purpose, protecting patients and improving care. Conclusion: a call to action. Reforming America's healthcare system is not an impossible dream, but a necessary undertaking. We've identified what's broken and what can be fixed. Now we must act because the status quo is costing both lives and dollars. Real change will take all of us. Policymakers need the courage to enact patient-first policies and invest in preventive care. Healthcare professionals must champion ethics and innovation, keeping patients at the center of every decision. And citizens must stay informed, hold leaders accountable, and embrace healthier choices to drive a cultural shift. Imagine a future where every decision in healthcare, from the hospital boardroom to your local clinic, puts patients first. Achieving it won't be easy, but it's within reach. If policymakers, providers, and communities unite behind this vision, we can rebuild health in America and ensure a brighter, healthier future for everyone.